Good evening. You're watching The Big Story with Haryanto Duman. I'm Olivia Quay. Ahead on the show, we speak to the 4 recipients of the Straits Times Generation Grit Award 2019. Their stories inspire us all. Before we begin though, if you're watching us on YouTube and haven't already subscribed to the channel, hit the red subscribe button below.
The total count of COVID-19 cases in Singapore has passed the 20,000 mark, with 788 new cases confirmed as of noon today. The Health Ministry said 11 of the new cases are Singaporeans and permanent residents. Migrant workers living in dormitories continue to make up the bulk of the remaining cases.
The full breakdown of the new cases will be released later today. Singapore now has a total of 20,198 cases, the most in Southeast Asia.
Let's discuss this further with Dr. Leong Hoe Nam, infectious diseases physician at the Rophi Clinic at Mount Elizabeth Novena. Doctor, Singapore crossed the 20,000 mark today. How significant is this number given the size of Singapore's population? Should we be surprised?
If you look at the number, I think it's just too many. But you have to take into the context that the majority of the 12,000 which we are seeing are actually from dormitory, representing the foreign workers. But if you look at the community at large, the number of infections that are unlinked are less than 5 every day for the last few days. So as a big number, it's terrible because it's coming from the foreign workers dormitory. Now, I'm not too worried about it because the foreign workers dormitory are all contained. They're not allowed to leave at this point in time, and neither can anyone go in without special permission, which means the numbers are there. The numbers will grow as we find out more and more about them, but it will not pose a greater risk to the community out in Singapore. Then as for the community out in Singapore, the number of cases are only about less than 5 a day, which are unlinked. So the probability of getting infected is less than 5 per million. Less than 5 per 5 million or less than 1 per million. The chance of getting it is very, very small. We're back to the days in February. So in that respect, I am not worried. However, this number is not the end game. In fact, I expect the numbers to go more and more. As the Singapore government extends its search and completes its search of the foreign workers' dormitories, I would expect the numbers to increase by several thousands, even to 20 or 30,000. But Singaporeans shouldn't be worried because Singapore is fine. For the foreign workers, the overwhelming majority are very young people. They have very, very mild symptoms, which means that they are going to come through the whole illness unscathed. Nonetheless, the healthcare system of Singapore is backing up our foreign worker population.
Right. Doctor, what else does the total figure of over 20,000 cases tell us? For instance, does it mean that we need more stringent measures? I know you just mentioned that we shouldn't be worried as a population, or is it a matter of us keeping at what we're doing currently and needing time for the circuit breaker to do its work?
I think rather what it tells us is we need to work even harder for the foreign workers dormitory. We need to separate out the clean cases, as in cases that are not infected, versus the infected cases, and tease them out so as to stop the transmission within the foreign workers. As we are speaking now, I'm very sure there are many cases which were infected in early April that have yet to be diagnosed, and I'm very sure there are cases who are still being actively transmitted or infected currently because they have not been teased out to who is infected and who's not infected. This just tells us that we have to work harder for our foreign workers, and that way we can keep the numbers down. Mind you, 200 to 300,000 foreign workers is a huge number. It's a tall order to even try to tease them out within the limitations of the dormitory and within the circumstances in Singapore. So Singaporeans, you just have to be patient. This problem will be solved eventually. What we need is time, a bit of space, and then we'll get it solved eventually.
Doctor, still on numbers and figures. Now, the number of new cases has been below 1,000 for the past 12 days. Do you think the virus has peaked here in Singapore?
I think in terms of absolute numbers, the peak infection is probably over. The numbers of 500 to 800, which we see every day, represents the cases that were infected earlier. Now, I expect the numbers to remain hover about the same. There might be some fluctuations of a few hundreds every day, but in the next 2 to 3 weeks, you see a downward trend in the numbers as we sieve out more and more of the foreign workers who have the infection and work them out correctly.
Dr. Leong, a 20-year-old nurse was confirmed as a case yesterday. He's the third healthcare worker from the community care facility at Singapore Expo to be identified as a confirmed case just in the past week. So what does this say about healthcare workers in these makeshift facilities compared to those, say, in the hospitals?
There are a few points which you can learn from this. Not just in Singapore, but in China and overseas, most of the healthcare workers do not get infected while at work. That's because they have the proper gear. You're talking about the mask, you're talking about the goggles or the eye shields, as well as the protective gown the person wears. And this has been proven very, very effective for all healthcare workers. So in this respect, I think that the infection probably occurred even from the person at home or when the person is traveling to and fro from work. Remember, there are up to 5 cases of unlinked transmissions happening in Singapore now. For all we know, this healthcare worker acquired it whilst traveling to and from work. In terms of the healthcare workers' protection and gear that's supplied, it has been proven many, many, many times that it is very effective. I must, however, admit that there is a possibility that there was a breach in infection control during the donning of the gowns or when the healthcare workers meet those people who are infected individuals. It also serves as a reminder to all healthcare workers that we have to be extremely vigilant when we're looking after patients with COVID-19. It also illustrates one further point. Healthcare workers are putting their lives on the line when we actually serve and look after these individuals. And I am very, very happy that many volunteers have come forward and people who are non-healthcare trained to come forward to help look after these patients. I hope that these cases that appear do not deter these volunteers from coming forward, but instead serves to encourage them to be even more vigilant and more careful so that they can look after themselves and yet be of service to the nation.
Well, Dr. Leong, it's always a pleasure having you on the show. We've been speaking to infectious diseases physician at the Rophi Clinic, Dr. Leong Hoe Nam.
Singaporeans will receive improved reusable masks soon as the government embarks on a third nationwide mask distribution exercise. In a teleconference with reporters, Trade and Industry Minister Chan Choon Seng said the new cloth masks will have better filtration capabilities, making them more breathable. Like the previous two distributions, Singaporeans will be able to collect the masks from community centres and residence committee centres. But this time, they will also be able to do so from vending machines. Mr. Chan added the distribution will take place close to the end of the circuit breaker period. More details will be announced at a later time.
The Health Sciences Authority has removed more than 1,700 listings of products from local websites since February for making false COVID-19 related claims. More than 1,600 warning letters were also issued to sellers and companies hawking such goods. HSA said that the companies were found falsely advertising general wellness goods as being good for coronavirus, as well as making unscientific claims of disinfectants being able to kill viruses, including coronavirus.
Singapore's the youngest COVID-19 casualty had been declared virus-free a week before she died. Ms. Salha Misbi had recovered from the virus, but the illness had already taken a toll on her body, affecting her kidneys and liver.
Meanwhile, a 61-year-old Singaporean man accused of attacking a safe distancing enforcement officer with a sharp instrument was charged today with attempted murder. He was accused of attacking the National Parks Board officer on Monday, seriously injuring the officer's chest, arm and hand. The man, who has a medical history at the Institute of Mental Health, will be remanded for psychiatric assessment for 3 weeks. He's due back in court on May the 27th. Well, let's check in with Dylan Ang for what's making headlines around the world.
Thanks, guys. Virologists in France have concluded that the coronavirus probably didn't come from China. That's because new findings reveal that COVID-19 may have been spreading there a month earlier than what had been initially thought. A hospital had retested all samples of pneumonia patients and discovered it had treated a man who had COVID-19 as early as December. But official statistics reported that the first COVID-19 cases occurred in people who returned from Wuhan at the end of January. In his latest push to reopen the US, President Donald Trump said that Americans should begin returning to their everyday lives, even if it leads to more sickness and death from the pandemic.
We have a great country. We can't keep it closed. I mean, I've had doctors say, well, why don't we close it for a couple of years? This is the United States of America. And you know what? The people of our country are warriors, and I'm looking at it. I'm not saying anything is perfect. And yes, will some people be affected? Yes. Will some people be affected badly? Yes. But we have to get our country open, and we have to get it open soon.
Meanwhile, Australian Prime Minister Scott Morrison is planning to reopen Australia in a COVID-safe environment. Australia has been largely successful in containing the outbreak. It has less than 7,000 confirmed cases and fewer than 1,000 active cases. The government announced that there will be 3 stages to easing restrictions, with cafes, restaurants and retail expected to be among the first to be allowed to reopen. Each state would move at its own pace, with the common goal of having most of their economies rebooted by July. That's it for our global updates. Back to you.
Thanks, Dylan. Also in the news, the Philippines' leading broadcaster ABS-CBN Corp had been ordered to cease its operations a day after its 25-year congressional franchise expired. Employing nearly 7,000 people, the media conglomerate operates radio and television stations nationwide and is a frequent target of President Rodrigo Duterte's tirades. Mr. Duterte had repeatedly threatened to block the renewal of the franchise after the channel angered him by refusing to air his campaign commercials during the 2016 presidential election. Opposition lawmakers described the order as ill-timed given the need to inform the public in the battle against the coronavirus.
In the US, a police officer in Utah was left stunned after he found a 5-year-old boy driving on a highway when he stopped what he thought was an impaired driver. The boy had told the trooper that he had left home following an argument with his mother, who had refused to buy him a Lamborghini. He then decided to take the car and travel to California to buy one for himself. Well, thankfully no one was hurt and no property found to be damaged.
Back home, department store Robinsons will be closing its outlet at JEM in August. This will leave the store with 2 outlets at the Heron and Raffles City. Robinsons is not the first department store in recent times to close due to the challenging retail landscape here. Isetan had closed its Westgate Mall outlet earlier this year, and Metro had shuttered its flagship store at the Centrepoint last year.
We want to now shine the spotlight on 4 millennials who have overcome various adversities, from sexual abuse and cancer to mental health issues, as well as taking up caregiver duties at 14. These individuals have shown courage and resilience, and they are the recipients of the Straits Times Generation Grit Award 2019. Now organized by the Straits Times and sponsored by reassurance company Swiss Re, the award celebrates young people in their 20s to mid-30s who have overcome major adversities in their lives to help themselves and their families, and also give back to society in their own way. The 4 individuals were among 21 nominees featured in ST's fortnightly Generation Grit series last year. Each of the 4 will receive $5,000 and a trophy. In light of the circuit breaker, though, there won't be an award ceremony, but we will be speaking to each of them very shortly. So without further ado, the 4 recipients are Melissa Chan, Asher Low, Mei Ting and Kanesh. Congratulations to you all. So let's learn a bit more about Melissa and Asher first.
My dad was diagnosed when I was 14 years old. My dad was always a very sociable person. He enjoyed having dinner parties. In the earlier stages, he was actually diagnosed with depression first. So he was very withdrawn. He didn't really enjoy meeting his friends anymore. But it was only until he went missing on one of his business trips that we realized that it was more than depression.
I was 8 years old when my father passed away. He was like a person who would give everything for me. But I remembered thinking to myself, like, what am I going to do from here on? What's going to happen to me? And I think growing up, it did affect me because I never had that father figure. It was always the me against the world kind of mentality.
So, Asher and Melissa, we want to hear more about each of your initiatives, but let's go back first to what inspired you to set up these projects in the first place. So, Melissa, let's start with you. Your father was diagnosed with young onset dementia when you were just 14 years old. On the one hand, you wanted to care for your father, but on the other hand, I guess you wanted what other teenagers want, a social life and have fun with your friends. So, how did you feel having to reconcile both aspects?
Hey, yeah. So I think personally, in my own experience, having gone through that journey, it's only now that I realize that it is a very isolating journey. When I was 14 years old and in my teens and went through it, it was often just doing whatever it took to be able to care for dad and help support mom in caring for him. So, we weren't equipped with the right information. We didn't know what was happening to dad. We didn't know, what dementia was, and it was tough to find information online. And with that, when you start seeing, a loved one, your father, starting to display certain symptoms of dementia and not understanding why, you naturally feel a certain level of guilt and having to be around more and support the family a little bit more. So with that, then there's that constraint of that push and pull and that tension between wanting to be at home and caring a parent, and then wanting to grow up and be exposed to newer life opportunities. So it was tough. I guess we, as siblings and myself, we just went along with it. But it was only, after that passed on and many years later when I started learning more about dementia and the experiences that I realized how it impacted me.
Well, Asher, let's bring you into this conversation. You struggled with body image issues and were feeling that you weren't enough for a very long time. Perhaps this is something that teenagers and young adults can relate to. So, but things started getting better for you when you found religion. So, what would you do or change if you could go back in time?
I think honestly, having the ability to look back with hindsight, I wouldn't change too much. Yeah, because who I am now is really based on the experiences that I have. The people that I'm impacting now is also because of the experiences that I have. And if anything, it would really be to spend a little bit more time with people that I care about, and spend a little bit more time with doing things that make more impact. Yeah.
Well,
Um,
no, go
yeah.
ahead, Asher. Asher, you can continue with your story.
Yeah, okay. I would say that in essence, I know people have difficulties with their own backgrounds often. There are always things that we can go back and change. And growing up, or in the past few years in my early 20s, I always imagined that it would be great if I could go back in time and make changes in my life. But now where I am right now, it's a lot easier to look back and say that, hey, that was those experiences were needful. Yeah, and those experiences were needful for me to be at the place where I am now and impact the clients, the people, the youths at the level that we are impacting them at now.
Right. Well, your initiative, Limitless, aims to encourage young people who need help to seek it. But in terms of operations, how does it differ from other organizations of a similar nature?
I think in terms of Limitless, the key thing that we do that is different is that we meet youths where they are. We make it as easy as possible for youths to seek help, right? And if that means that we go out and meet them at the coffee shop instead of having counseling in a counseling room, we do that. If it means that we are going out to meet them at their schools, or it means that we are meeting them below their void deck and doing the therapy there, that's what we do. If it means that we have to do it on WhatsApp and we do it via phone call, then we have to do it that way. So that's one of the main areas in which we do things very differently, and we find that there's a good response from the youths because they feel that their needs are being met and they are not afraid to be confined within the four walls of a counseling room. I mean, another thing that we do very differently is that we make it a point to ensure that every young person gets the help that they need. And if that means that they come from a semi-abusive family or a family that that makes it difficult for them to seek help. For example, if the counselor or the agency says that, oh, you cannot seek help without getting a parent's approval, um, we decided not to do it that way, but instead, like, hey, let's work with you and let's eventually reach a point whereby we can work with your parents. But if anything happens or if there's any emergency, we will need to inform someone.
Of course.
Yeah.
Well, Melissa, tell us about your initiative, Project We Forgot. How did your own experience make you deliberately want to come up with this idea to help others? Was there any specific incident that you recall when you interacted with your father that helped you spark the idea?
Yeah, so I think with Project We Forgot, that was really a sum of the experiences that I had gone through with my dad. So with my dad's journey, that was about 10 years, where he was living with dementia. And over that 10 years, at different stages, it's very, very different. Uh, in the earlier stage, he's still high functioning. He's still able to go out. Sometime a couple years later, he would, slowly start showing progression. And then there were times where he forgot how to get back home, or he would forget our names, or he would lose certain abilities of doing his daily activities of daily living. So I guess over the 10 years, there were a lot of experiences. And throughout the 10 years, there was always that question mark of like, are there other families that are going through a similar experience? And how can we get connected to these families? Yeah, so I think, after Dad passed on, my background was in communications and branding. And I also realized through research and through having access to a lot more of internet and being able to search things online, that there was a lot of information about dementia, but very little that touches on the human experiences and what people go through during that journey. So most of the information was very medical focused. So from there, I think that largely inspired the work that we do around advocacy and awareness. Trying to lower barriers to entry to help people get support. Help change perception of what dementia is, help change perception of what caregiving for a loved one with dementia is, and in a way increase that support levels for caregivers. Um, yeah, so essentially, that really is the work that we do.
Well, Melissa and Asher, thank you very much. Congratulations, and we hope you'll be able to put the $5,000 to good use to further your causes. We haven't forgotten about the other pair of award recipients, Mei Ting and Kanesh. Here are their stories.
I can only recount that like I was being touched when I sleep at night. I didn't know what was right and wrong. It was being repeatedly. Then my aunt came to discover when she found that every time after I came back from my mom's place, I'll be very moody. So she actually came to discover that I was abused, and she brought this case up to the police.
My passion was to become a pilot, and I really like planes a lot. So I have plenty of photos of me with planes since young. It was during my PSLE period, so it was pretty tough period for me, and it took about 1.5 years of treatment to actually come out of it.
So we welcome Mei Ting and Kanesh. Mei Ting, let's start with you. Thank you for sharing your inspiring story. We understand that you went for counselling for 10 years. Was there a distinct moment during the counselling sessions that sparked a change that encouraged you to speak up about your abuse?
I would say it's a progressively process throughout my years of counseling. When I was in primary school, my counselor once shared a book with me on how this individual managed to put down her past and speak up. I was young back then and was not ready. I had a lot of worries like my mom will abandon me, how would be able to face my friends in school, and so forth. But deep down, I was quite impressed with her courage and I yearned to be like her. Moving on, when I was in secondary school, where we have assembly talks, where our school would invite all the inspiration figures under a part of a character and citizenship curriculum. So all this school resilience workshop helps me to build on my confidence and self-esteem. And plus, I also read up on motivation stories and articles that allows me to actually share with my stories today with everybody.
Well, Kanesh, over to you. You had cancer at 11 years old, recovered, and then it returned a decade later. So what was your first reaction when you found out that the cancer had come back?
Okay, it was overwhelming to know that something you thought you can put behind yourself has come back again and to disrupt your life once again. But this time I was better able to respond to it as I'm much more mature compared to when I was young. Since I'm generally characterized to be a problem solver, I started thinking of how I can organize myself and all the things that took a hold. Eventually, the greatest concern is to mitigate the impact emotionally with my family because it's as tough on them as myself. Um, then you also have to, display strength and positivity to keep things afloat.
Well, of course. So, Mei Ting, let's go back to you. Victims of sexual abuse often feel stigmatized if they speak up. Was that something you were afraid of? And what's your advice for someone who's in that situation? How would you encourage them to tell somebody about it?
Yes, definitely. I was afraid on others people's judgment. After sharing at first, I was a bit worried on how my friends will react when they read the news and whether I'm able to handle it well. I was talking to a close friend about it, and she was reassuring me by directing me back to my aim. She reminded me that I cannot be responsible for the reactions of others, but I can take control of my actions and be prepared for the outcome. My encouragement would be take baby steps. Sometimes it will seems to be one step forward, two steps backward. Be patient with yourself. It takes time and the road of recovery is very long. The amount of time for recovery depends on each individual, and do not feel pressurized to say everything at one go. If possible, talk to a counselor to work things out that who's that trusted person could be for you. The most important thing I feel is you must believe that you have the right to pursue healing and justice for what has happened, and no one has the right to abuse you.
Well, thank you for sharing that, Mei Ting. So, Kanesh, let's wrap up the interview with you. You majored in mechanical engineering and you expressed a passion for planes as well. I understand that you and your company are currently developing a solar-powered plane next. So, tell us more about that and what other plans do you have for the future?
Yeah, so my strength lies in being innovative and being able to provide solutions. So I felt that since that's my strength, I should do something in the line. And building a solar power plant was a long-term dream project for me, and I felt that I should do it regardless the high chance of risk and failure. So I mean, I could have joined the company and started working, but I felt this was more fulfilling for me to do while taking treatment at the same time.
Right. Well, Mei Ting and Kanesh, thank you so much for your time. Overcoming those adversities, especially at such a young age, is truly inspiring. Now, the Gen Grit Award celebrates young people like you who have shown courage and resilience in difficult times. I'm Olivia Quay, and on behalf of Haryanto Daman and Dylan Ang, thank you for watching. Have a good Vesak day. We'll be back on Friday. Congrats once more to the 4 recipients of the Straits Times Generation Grit Award 2019.